Some Canadians traveling to Florida are asking new questions.
We've had our first patient who called in and wanted to learn a bit more and wanted to see if anti-malarial drugs were a requirement for traveling to Florida.
The answer is no. 5 unusual malaria cases have been reported in the U.S. over the past month. Doesn't sound like much, but top American health officials issued a health advisory warning people to be on alert.
Malaria is a life-threatening disease. It's not often seen in the United States, and we haven't seen it domestically acquired in over 20 years.
Domestically acquired is key. It means mosquitoes in the U.S. are infected and spreading the disease.
It is a little alarming to have a disease that we've eliminated from the United States and then have these few local cases.
Eliminated in the U.S. and Canada with public health measures, but worldwide 2020 saw about 241 million cases of malaria. 627,000 people died, most of them children in sub-Saharan Africa. About 500 cases of malaria are diagnosed in Canada each year, mainly travelers.
It's always a good idea, regardless of what infection we're talking about, to avoid bug bites.
There's no vaccine for malaria, but there are treatments. Doctors advise travelers use bug repellent, cover up at dusk and dawn, and sleep in air-conditioned spaces.
There's a resurgence of malaria in many parts of the world.
Infectious disease doctors say climate change is allowing various types of mosquitoes to thrive in new areas, bringing diseases like Zika, dengue, and malaria with them.
I wouldn't say we need to sound the alarm bells today, but it is perhaps an indication of what may be forthcoming.
American health authorities say all 5 patients who contracted malaria have since recovered. Doctors on both sides of the border say there will likely be more cases. Christine Burak, CBC News, Toronto.